The World Health Organization now says that the mosquito-borne Zika virus is spreading, quote, explosively in the Americas. Catherine is back now with the latest on the virus, which has dangerous implications for women who are pregnant. Catherine.
Yeah, as you know, Pam, there's already great concern about the Zika virus. It can lead to major birth defects. Health officials are raising alarm over the Zika virus, but in Brazil, the warning sirens have been blaring for months. More than 4,000 babies there have been born with a condition resulting in abnormally small heads, meaning brain damage and long-term developmental problems.
The Zika virus has pregnant women worried about the health of their babies. And as the weather warms up, we're all at greater risk for contact with bugs that bite and sting. Here to help explain how to protect yourself and your family is Dr. Frieda Lewis-Hall, Chief Medical Officer of Pfizer. Welcome.
Zika's been in the news so much lately. It really reminds us that bugs can be more than a nuisance. They can be downright dangerous. The advice is for pregnant women to avoid travel to area that Zika has been shown to be spreading in, and to be tested for the Zika virus if they've recently returned from a trip to one of those areas.
Mosquitoes are a risk in the day and the night, so make sure you're applying insect repellent frequently. One other thing you can do to protect yourself is as simple as wearing long sleeves, longer pants, and then stay in places where mosquitoes are blocked. You can use screens, nets, and if you're using an air conditioner, obviously you can keep the mosquitoes out. Let's move on from what bites you to what stings you. Bees, wasps, fire ants, they usually don't carry disease, but in their case, it's the venom in that sting that can really affect you.
If you're stung by a bee or a wasp, you should check carefully to make sure that the stinger is out. If it's not out, you want to remove it carefully and quickly. Now, fire ants are another story. You should kill the ant immediately with a slap. Then remember that their venom is an irritant, so you want to clean that area right away and thoroughly, and you want to keep it clean. And I know this is the hardest advice of all, don't scratch it. In some people, a sting can be deadly if they're severely allergic to the venom.
Dial 911 if you or someone you are with has difficulty breathing, becomes hoarse, they start wheezing, you start to swell around the face, hands, feet. If you're worried, it can be a deadly situation. Our last insect won't bite and flee. This one's going to stick around. Ticks.
They can be anywhere in your body, but they tend to really want to be in warm, moist places, in your armpits, in your groin, or in your hair. Early removal is important with a tick because it generally takes around 36 hours for them to begin to transmit disease.
If you are bitten by a tick, use fine-tipped tweezers to grasp that tick as close to the skin surface as possible. You want to pull upward with steady, even pressure. You don't want to twist or jerk the tick because this can cause parts near the mouth to break off and remain in the skin. Thoroughly clean the bite area and your hands with rubbing alcohol, an iodine scrub, or soap and water.
You also want to make sure that you don't squeeze it, puncture it, because you'll push the infected material that's in the tick into your wound. It also means you shouldn't do some of the things you've heard. Do not put a hot match tip on it or paint it with nail polish, kerosene or gasoline, any of those things, because that may have the same effect. So here you have the tick out. How do you want to dispose of this tick? You want to make sure that if they're alive still, and they are likely to be, you want to submerge them in alcohol. Then you want to put them in a closed container, a sealable bag, something like that, and you want to dispose of it after you've wrapped it tightly with tape. If all of that isn't available to you, you can always flush it.
Do keep a lookout for a circular red patch or what we call a bullseye. Ticks can carry Lyme disease, which can make you feel like you have the flu. Other symptoms include weakness and fatigue, joint pain, headache, and muscle aches. Symptoms can be very mild. They may not even show up at all. Most cases can be treated with antibiotics, especially if treatment is started early. If it's left untreated, infection can spread to the joints, heart, and nervous system. So see a doctor if you experience any unusual symptoms and are concerned.
And you know, this information is important for people who camp or hike or fish, but not just for them. You know, ticks are spreading in suburban areas too. They tend to live in grass or shrubby areas outside, and basically be sure that you have insect repellent on when you're outside. And when you come in from outdoor activities, you want to make sure that you've checked yourself thoroughly, that you take a shower, make sure that you've checked family members, and that includes the family pet. And there's lots of information to know about bugs, how to take care of their bites, and also how to prevent them. So people can always go to gethealthystayhealthy.com. And while they're there, they can sign up for the Get Healthy, Stay Healthy newsletter.
Great info. Thanks as always.
Thank you.
And you can visit thedoctorstv.com for more info. We'll be right back.